Welcome everybody back to Madison County Live, a special segment with a very special guest from the Madison County Health Department. Welcome, Margaret. So first of all, introduce yourself and tell us what you do there at the Madison County Health Department.
Well, my name is Margaret Maupin Story. I'm a registered dietitian and I am a diabetes educator with the Madison County Health Department. And thank you so much for having me.
Well, thanks for coming.
Yes.
So we're going to dive right into it. So tell us, in your words, what is the most important about diabetes education and the classes that you offer?
Well, only about 7% of the people who are diagnosed with diabetes, initially diagnosed with diabetes, actually attend a diabetes education self-management class. And it's very important because we need to teach people how to eat,
Right.
how to count their carbohydrates. We need to tell them what is happening with their body. And it's not only the pancreas
Right.
that is involved here, but there are other major organs that are involved with diabetes, type 2 diabetes, I should say. We need to teach them the importance of exercise and how that affects their blood sugar, how to prevent complications of diabetes. And those are major organ damage. So this, and how to take care of themselves.
Right, correct.
How to take care of their feet, how they need to, what they need to say to the doctor. And most important is how you carry on a conversation with the physician, what to ask, what to tell them,
Right,
and
right.
what to take along to your visit, like your blood sugar record. Going to the doctor without your blood glucose record that you've been keeping is like going to the dentist without your teeth.
That's a very good example.
The doctor, well, I heard a doctor say that.
Right.
But the doctor has to know what your blood sugars
Sure.
are.
Right. And I know Kentucky is really bad for diabetes in Kentucky. So what are those contributing factors with that, you think?
There are 475,000
Wow.
adults in the state of Kentucky that have been diagnosed, or I should say have diabetes.
Right.
Some of them don't know they have
Oh, that's
diabetes
true.
because they haven't been to the
Exactly.
doctor. So we are talking about a lot of people in Kentucky. 1 in 7 adults has diabetes. What contributes to diabetes? Genetics. Being a little fluffier, like a little overweight,
Right. I like that term, fluffier.
fluffy, a lack of exercise, and age. I hate to say, but
Right.
age, because the older we are, the more likely that our pancreas doesn't work as efficiently as it
Right.
once did.
Correct. So at the Madison County Health Department, what are you all doing? Tell us about your classes and the preventative measures and
Well-
everything that you offer.
Well, here's what we offer.
Okay.
We offer a class, a self-management education class, and we come under the umbrella of the state program, which is called Healthy Living with Diabetes. It's a wonderful program. It's an 8-hour program,
Okay.
and we provide that absolutely free.
Wow.
Free. And we take people out of Madison County or anywhere within the state of Kentucky.
Oh, that's
And-
nice.
Right.
Oh, that's really nice. Okay.
And we like 18 years old. You have to be 18 years of age.
Okay.
Now, I have had some teenagers that were like 16 and 17 that
Okay.
would come to the class.
Okay.
We also have parents of children that have been diagnosed with diabetes, or caregivers.
Right.
If you have a parent with diabetes, you're certainly welcome to register for our class.
That's great. And these classes, folks, are free.
They are free, and
Yes.
we're approved by the American Diabetes Association.
that's great.
And the Association of Diabetes Care and Education Specialists.
Okay.
And you have to jump through a lot of hoops to
Yeah,
get
to
that.
do that, yes, I know, it's very
right.
stringent, right.
And you still have to jump through hoops after you get it, because every year you have to turn in the evidence that
Right.
you have been successful working with the patients and the participants you've seen in your classes.
So it's an ongoing process.
It's an ongoing
Wow. Okay.
process, yes.
So give us some examples. What do you all talk about in your classes?
Oh, well, I try to make it fun, and I work with Laura Shelton,
Yeah.
who's a registered nurse
Right.
and a master's level educator, and we try to make it fun, okay?
Good.
So we start with, what is diabetes? What's actually happening? And why do you get complications?
Right, from that, right.
From that.
Okay.
And then we talk about carb counting, food.
Yes.
And everybody likes to eat. I had a lady in my last class who said she was once told that she could only have boiled chicken and rice. Oh no, we had to straighten that out right away.
Right.
Then we go on to medications. How are your medications supposed to work?
Right.
And are you taking those correctly?
Right.
And then we talk about exercise and what we call exercise, and some of the exercises that you can do
Okay.
with diabetes, indoors and outdoors. Okay. And we also talk about monitoring, what time you monitor, where you get the best results.
Okay.
And the methods you can use, the schedules you can use.
Sure.
And something very important, stress of having diabetes.
I've heard that, right.
And also depression. Depression sort of goes hand in hand with diabetes. So we have to address that with our participants. We also have follow-up every month, not in December, but every month we have a support group.
Oh,
And
right,
our
right.
support people can come, they can meet with us. We have a little teaching moment, but then also we have participants that just want to ask, they have a problem.
Informational, right,
So
informational,
they
yeah.
want to throw it out to the group.
Okay.
Have you ever had this? What did
Right.
you do about it? And it's a very nice group of people.
It is. I attended, got some video. I don't know if you saw Margaret and Laura on the last video, and some testimonials from folks that were there. I learned something when I went just for Media Day. Speaking of
great.
which, Diabetes Awareness Day is coming up. Tell us
It
about
is.
that.
November 14th is World Diabetes Day, and you're going to see some buildings throughout the world bathed in a blue light.
Nice, very nice.
So we want to make sure when you go to the doctor, you want to address the possibility, could I have diabetes?
Sure.
You can go to the American Diabetes Association. They have a risk form where you can fill out the form and determine if you are at risk
Sure.
for diabetes.
Right.
There are some pre-diabetes classes,
Okay.
and we do not presently offer that. But on the Kentucky Diabetes Resource Guide, you can look on that guide, and it will tell you all the sources in Madison County that will provide that, or out of the county. Mostly it's going to be out of the county, virtual presentation.
Okay, right, okay. So you don't have to leave your home?
You don't have to leave
Nice,
your home.
okay.
You can be right on
Sure.
your computer.
Excellent,
Yeah.
excellent.
I have had participants who had prediabetes. Can I come to your class? I welcome them.
Right.
Come right on. We'd be happy to have you in our class.
And of course, your website, Madison County Health, DEPT.org, is chock full of information under the diabetes tab too.
Yes, and so we can talk to these people.
Okay.
We can get them on really a plan where they can lose weight.
That's fantastic.
And most people we see, type 2 diabetes, they tend to be a little fluffier and would certainly benefit by having some weight loss.
Right, right. You even said you would help them with meal planning.
Oh, yeah.
That's fantastic,
Oh, yeah.
right?
Oh, yeah. We have models. We have fun. We
That's
have
great.
fake food. We have models.
Nice. And people that want to drop by and see what the class is like, that's free to do also, correct?
I don't mind if they sit in.
That's
I don't mind
fantastic.
at all.
And they're a great group of people. Diabetes, if you get that under control,
Yes.
you just feel a whole lot better.
I've had people who have wrestled with trying to manage diabetes for 15 years.
Right.
And they will say, oh, I didn't know that. Well, I didn't know that. Will that cause my blood sugar to go up? Well, here's the information.
Right.
Yes, it will.
Wow.
It will.
And people can call too. What's your phone number?
Well, for right now, it is 859-228-2044.
Okay.
That's our Berea office,
Okay.
and they will relay your name and number
Sure.
to me.
Okay.
These are some, I think, heavy facts
Okay. Give them to us.
from the CDC.
Cool.
By just attending.
Just attending the
class.
the class.
Yes,
Wow. Okay.
yes. And I have to read them off because I can't remember all
Sure,
these
sure. There's a lot.
percentages.
Right.
It reduces your heart disease and stroke by 12 to 27%.
Excellent.
Yeah. Risk of progressive kidney disease by 30 to 70%.
That's
Yes.
a lot.
Cholesterol management can reduce cardiovascular complications by 20 to 50%. Regular eye exams and timely treatment can prevent up to 90% of diabetes-related blindness.
Really. Wow.
Regular foot exams and patient education can prevent up to 85% of diabetes amputations.
That's a lot.
Yes,
That's a
we
big
teach
number.
patients, look at your feet every
Look at
day.
your feet every day.
Bottoms, tops, in between your toes.
Wow. See, that's
Yes.
something that people don't
Yes.
normally
Yes.
realize.
And it takes a minute.
And takes a minute to do.
Takes a minute
Wow.
to do.
Margaret, for more information, how do people sign up for the classes?
Well, same number, 859-228-2044. And we have a class schedule now. When we have demand for class, then we schedule.
Then you schedule. Okay.
We
Is there a
schedule.
limit on the class size? Or like you want to keep it into?
Well, if we get too many, we'll just do two
Oh,
classes.
you do 2 classes, so there's really no limit. That's great.
Yeah,
Excellent.
yeah. We've had up to 15.
Wow, okay.
We've had as small a number as 4.
Wow, okay.
Ideal is around 8.
Right.
Right, 8 folks. And then we can sit and answer questions.
Yep, they're very informative. They answer all kinds of questions. I can be witness to that.
And if we don't know the answer, we have CDCs or
Right.
CDEs.
Yep.
We have master's level educators at our Frankfurt office who've been involved in diabetes for 30 years or
Wow.
more.
So they know the answer will be found for you.
The answer
Right.
will be found.
Excellent.
Yes,
Right.
we will
That's
find
fantastic.
that answer.
Margaret, thanks for coming in.
Well, thank you
You
for
are
having
a wealth
us.
of information, folks. Check them out on the website and the number that Margaret gave, Madison County Health Dept.org. Like she said, they can get classes together anytime.
We will certainly
Excellent.
try. We want to help. And not only those folks in Madison County, but we take people with
Right, surrounding
surrounding
counties as well.
Absolutely.
Right. That's
As long as
fantastic.
they're live in Kentucky.
Right. That's excellent. Margaret, thanks for coming in.
Well, thank you very much.
Hey.
Very much.
Thanks for watching, everybody.